Chronic osteomyelitis and chronic septic arthritis. These are usually from inadequately treated acute episodes, which include acute osteomyelitis, acute septic arthritis, acute on chronic osteomyelitis, and acute on chronic septic arthritis. So some may arise from the onset as a chronic infection due to mycobacteria or fungi, and the patient is usually not ill looking unless there is acute exacerbation. Causes are acute bacterial infections of bone and joints, mycobacterium tuberculosis, and fungal infections, affected orthopedic implants, and iatrogenic causes. So the symptoms are chronic discharging cyanosis, pain, and deformity. The signs that are usually elicited are swelling, tenderness, deformity, scarring, chronic discharging cyanosis, and hyperpigmentation of the involved parts. Investigations are FBC, ESR, X-ray, CT scan. The main treatment objectives are to eradicate infection, restore function, prevent and correct deformities. Non-pharmacological treatments include wound dressing, splinting surgery, sequestrectomy, and implant removal. And pharmacological treatment for acute flare-up of infection. First-line treatment, give clozaceline IV in adults 500 milligrams 6 hourly for 2 to 4 weeks. In children 5 to 12 years, give 250 milligrams 6 hourly for 2 to 4 weeks. 1 to 5 years, give 125 milligrams 6 hourly for 2 to 4 weeks. Less than 1 year, give 62.5 milligrams 6 hourly for 2 to 4 weeks, and then you give ciprofloxacin IV to be infused over 60 minutes. In adults, 400 milligrams 8 to 12 hourly for 14 days. In children, 10 milligrams per kilogram 12 hourly for 14 days. For acute flare-up of infection in patients with penicillin sensitivity, first-line treatment, you give clindamycin IV in adults 300 milligrams 6 hourly for 7 days. In children, 3 to 6 milligrams per kilogram 6 hourly for 7 days. And then you give ciprofloxacin IV to be infused over 60 minutes. And adults, 400 milligrams 8 to 12 hourly for 14 days. In children, 10 milligrams per kilogram 12 hourly for 14 days. For acute flare-up of infection in patients with sickle cell disease, first-line treatment, you give clozaceline IV in adults 500 milligrams 6 hourly for 2 to 4 weeks. In children 5 to 12 years, give 250 milligrams 6 hourly for 2 to 4 weeks. 1 to 5 years, give 125 milligrams 6 hourly for 2 to 4 weeks. Less than 1 year, give 62.5 milligrams 6 hourly for 2 to 4 weeks. Then you give ciprofloxacin IV to be infused over 60 minutes. In adults, 400 milligrams 8 to 12 hourly for 14 days. In children, 10 milligrams per kilogram 12 hourly for 14 days. The second line treatment, give clindamycin IV in adults 300 milligrams 6 hourly for 4 weeks or until clinical improvement. In children, 3 to 6 milligrams per kilogram 6 hourly for 2 to 4 weeks. And then you give ciprofloxacin IV to be infused over 60 minutes. In adults, 400 milligrams 8 to 12 hourly for 14 days. And in children, 10 milligrams per kilogram 12 hourly for 14 days. Or amoxicillin clavulanic acid IV in adults, 1.2 gram 12 hourly, increased to 1.2 gram 8 hourly for 7 days in severe infections. And in children 12 to 18 years, give 600 milligrams to 1.2 gram 12 hourly, is increased to 1.2 gram 8 hourly for 7 days in severe infections. 3 months to 12 years, give 30 milligrams per kilogram 12 hourly, and increase to 30 milligrams per kilogram 8 hourly for 7 days in severe infections. 7 days to 3 months, give 30 milligrams per kilogram 8 hourly for 7 days, and preterm and less than 7 days, we give 30 milligrams per kilogram 12 hourly for 7 days. And you give ciprofloxacin IV to be infused over 60 minutes. In adults, 400 milligrams 8 to 12 hourly for 14 days, and in children 10 milligrams per kilogram 12 hourly for 14 days. You treat pain relief appropriately to referral criteria. So patients should be referred as soon as possible to an orthopedic specialist.